Bulimia. What is bulimia?
Bulimia is another type of eating disorder where a person consumes large quantities of food and get rid of the food that they've consumed by either purging, throwing up, excessive use of laxatives, excessive exercise. And sometimes it doesn't even mean that they have to consume large quantities of food. Sometimes even a small quantity of food is going to be perceived as overeating, and the person will resort to these measures, purging, laxatives, excessive exercise to get rid of the food.
But they know if they're heavy, they know they're heavy. They're trying to find this method to reduce the weight, or they don't know they're heavy.
But a lot of times people who are bulimic are not heavy.
Excuse me. Their image is not what they like, and they're going to use the technique to get the image in a direction they like better?
Right.
Okay, but they know it. Is that correct? They're doing this themselves, or they don't know it?
It's something that a person is purposely, consciously doing.
If it's something they just out of nowhere, they are really saying, I can control this by getting the calories out of the body.
Deliberate. It's deliberate.
Okay, and if someone is bulimic, is there any dangers of the vomiting or the diarrhea that you get from the laxatives?
There's a lot of dangers with bulimia. Vomiting can cause dehydration. It can cause changes in potassium levels. There can be damage to the esophagus as a result of purging. There can be gastrointestinal problems that occur that sometimes become irreversible.
The stomach acid coming up, like people sometimes have reflux, destroys the teeth, the lining. And if you have acid against a healthy area like esophagus, you could probably have damage and maybe have a higher risk of things like cancer down the road.
Yes, absolutely. And
if you take a lot of laxatives and you get out the other end, it's like anybody. Someone gets diarrhea, they can dehydrate, as you mentioned, and then get electrolyte disturbances. Mm-hmm. And sometimes they can lead to things even like convulsions if you're not careful.
Right.
So it's not something you do, and it should be warned not to do. And if these things were very successful in getting people to, there would be a doctor that would never be heavy. They would use these techniques, so they would know about these techniques. And we do have some heavy doctors now and then, don't we?
Unfortunately, yes.
So it's not a method that you really should go to. Is that correct?
It's not a successful method actually in reducing weight. People think it is, but it's not an effective method of weight loss or weight maintenance.